AI in Healthcare and Digital Health Update, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. China's humanoid robotics sector is shifting focus from hardware to intelligence. Dobot and UB Tech are prioritizing so-called robot brains, with Dobot shipping a third batch of its full-size Atom humanoids and introducing a self-developed vision language action model. UB Tech has open-sourced its multimodal thinker model and reported strong factory task accuracy for its Walker S2 system, although endpoint specifics have not been independently verified. According to Omdia, global humanoid robot shipments reached 13,318 units in 2025, representing approximately 480% year-over-year growth, with Chinese companies leading deployment. In the United Kingdom, NICE has issued final guidance recommending Abbott's CardioMEMS heart failure system for adults with chronic heart failure who are at risk of hospital admission. Heart failure affects around 920,000 people in the UK and costs the National Health Service approximately £2 billion annually. NICE cited evidence from 3 randomized controlled trials showing a 34% reduction in heart failure hospitalizations, compared with usual care, supporting broader adoption of daily at-home pulmonary pressure monitoring. In consumer health technology, reports indicate Apple has scaled back plans for its AI health coach initiative, known internally as Project Mulberry. According to a Bloomberg-sourced report, some features originally intended for a standalone service may instead be integrated gradually into the health app and future Siri upgrades, although specific timelines have not been disclosed. The move follows leadership changes across Apple's health and artificial intelligence teams. In the United States, Lotus Health has raised $35 million in a Series A funding round to expand a free AI-led primary care service. The platform offers 24/7 access in 50 languages, operates across all 50 states, and uses board-certified physicians to review diagnoses, laboratory results, and prescriptions generated through AI-assisted workflows. The company reports that the service remains free while its long-term business model is evaluated. Security concerns continue to surface around agentic AI platforms. Following its rebrand to OpenClaw, researchers have reported exposed dashboards, credential leaks, typo squatting, and cloned repositories linked to misconfigurations and rapid enterprise adoption. Analysts also note increased shadow IT usage, with some users granting high-level system permissions without organizational approval. Relatedly, OpenClaw agents have spawned Maltbook, a social network designed for AI-to-AI interaction via downloadable skills. Maintainers emphasize that the platform is intended for experienced users, citing prompt injection and access control risks. Despite surpassing 100,000 GitHub stars, developers continue to caution against general user deployment. In South Korea, Samsung Health has achieved the country's first digital health registration under the new Digital Medical Products Act. Core Galaxy Watch 8 features, including heart rate, blood oxygen saturation, and step tracking, are now registered as digital medical and health support devices. The framework introduces voluntary reporting and performance certification for digital health technologies. In research tooling, OpenAI has launched Prism, a free AI workspace for scientists. Prism integrates GPT 5.2 with LaTeX and visual tools to support drafting, reviewing, and revising scientific work. OpenAI states the platform is designed to enhance workflows by maintaining full project context rather than conducting research autonomously. Finally, the Heart Failure Society of America and the American Association of Heart Failure Nurses have issued a scientific statement on integrated health technologies in heart failure care. The review highlights evidence across telemonitoring, mobile health, and implantable devices. noting that clinical impact depends heavily on patient adherence, interoperability, clinician workflow integration, and data security. Stay ahead in AI in healthcare and digital health research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consultants.